Dr. Matthew Greenberger, and I'm here today to talk about kidney stone treatment and prevention. Kidney stones will affect 1 in 8 people during their lifetime, and about 50% of people will have another stone in the course of their lifetime after experiencing a first stone episode. It used to be true that stones were mostly a disease of men. However, over time we're finding that it's a nearly 50-50 distribution of kidney stones between men and women. The presentation of kidney stones is usually quite extreme flank pain, as a lot of people have heard, but some people present with more subtle symptoms, such as more of a mild backache, blood in the urine, or other urinary symptoms. When a kidney stone is suspected, the current standard diagnostic workup would be a CAT scan without the need for IV contrast. There's still a role for plain abdominal x-rays as well as ultrasound, but the most accurate and sensitive x-ray will be the CAT scan to ultimately help us guide treatment. There are many treatment options available for kidney stones. The easiest is a trial of stone passage, which is a very good option for stones 5 millimeters in size or less. For stones that are not passing or for people having extreme pain, minimally invasive treatments are available. Most people have heard about shockwave lithotripsy, where shockwaves are focused on the stone from outside the body to break the stone up into small pieces which can pass. This is certainly the least invasive treatment and is a good treatment option for stones that are up in the kidney and not currently causing a blockage. And it is also a treatment option for some ureteral stones. Another minimally invasive option is called urethraoscopy. A small scope can be introduced through the urethra and up to the level of the stone, and a laser is used to fragment the stone and remove the pieces. This can result in a higher stone-free rate at the end of surgery, although it is slightly more invasive. A more invasive option is available for larger stones called a percutaneous nephrolithotomy. A 1-inch incision is made in the back, and a tract is made straight through the back into the kidney. This is the treatment of choice for stones over 2 centimeters in size, as it allows stronger, larger instruments to be introduced so that the stone can be fragmented and removed, and it results in a greater than 90% stone-free rate in a single surgery. Open surgery for kidney stones is rarely indicated in the modern age. Most people who've experienced a stone are willing to do anything they can to help prevent having another stone episode. The mainstay of prevention is to increase fluid intake to help increase urine volume and keep the urine more dilute so crystals don't form. It's also important that people know not to cut calcium out of the diet. While this was the advice for many years, recent studies have shown that extremely low calcium diet can cause more stones, as can an extremely high calcium diet. Moderate calcium levels in the diet are best for prevention of stones. Another way to help prevent stones is a low animal protein diet. Protein in the diet can increase uric acid levels, which can help increase stone formation. And also a low sodium diet is helpful to lower urinary calcium. Finally, citrate is present in the urine naturally and acts as a stone inhibitor, and citrate levels can be increased by drinking lemonade 3 times a day or increasing the intake of other citrus fruits. If you have kidney stones or if you have a history of kidney stones, please feel free to call St. Joseph Hospital for a referral to one of our urologists.